If you are over 60 and you have been feeling unusual tiredness, shortness of breath, or a strange pressure in your chest that comes and goes, cardiologists are now saying that these could be early signs your heart is under serious stress. And the most alarming part is that millions of seniors experience these symptoms every single day and simply brush them off as normal aging. I want you to really think about this for a moment. How many times have you woken up in the morning feeling like you just did not get enough rest, even though you slept for 7 or 8 hours? How many times have you felt a little winded walking up a short flight of stairs, or noticed your heart beating harder than usual after a simple task like carrying groceries inside? Maybe you have experienced a dull ache in your chest that lasted a few seconds and then disappeared, and you told yourself it was nothing. You are not alone. I hear stories like this from patients almost every single week, and nearly every one of them tells me the same thing. They say, Dr. Williams, I just thought it was part of getting older. I did not think it was my heart, but here is what I need you to understand. According to leading cardiologists and heart specialists, the heart does not suddenly fail without warning. It sends signals, sometimes months or even years in advance. The problem is that most people do not recognize those signals for what they really are. They mistake them for fatigue, stress, poor sleep, or simply the natural effects of aging. And by the time they take those symptoms seriously, the damage to the heart may already be significant. My name is Dr. Michael Williams, and I have spent years helping seniors understand the warning signs their hearts are sending them. I have seen firsthand what happens when people ignore those signs, and I have also seen the incredible difference it makes when someone catches a problem early and takes action. That is exactly why I made this video today. In this video, I am going to walk you through the 7 warning signs that cardiologists say seniors should never, ever ignore. Some of these signs are well known, but others are going to surprise you. I am also going to explain why these symptoms tend to appear or get worse after the age of 60, and what is actually happening inside your heart and blood vessels as you get older. And at the end of this video, I am going to share the single most important piece of advice that heart doctors give to their own family members. So please stay with me because this information could be one of the most important things you hear this year. Let us start with the first warning sign, and it is one that catches almost everyone off guard. It is unexplained fatigue. Now, I'm not talking about feeling tired after a long day of yard work or a busy afternoon with the grandchildren. I am talking about a deep, heavy exhaustion that does not seem to match your activity level. You wake up tired. You sit down after a simple task and feel like you need to rest. You notice that activities that used to be easy for you now leave you feeling drained. Many seniors tell me they feel like they are moving through mud, like every little thing takes twice the effort it used to. Here is why this matters so much. When your heart is not pumping blood as efficiently as it should, your body does not receive the oxygen and nutrients it needs to function properly. Your muscles get less fuel, your brain gets less oxygen, and your body responds by making you feel exhausted, even when you have not done anything particularly strenuous. Cardiologists say that unexplained fatigue is one of the earliest and most commonly overlooked signs of heart trouble in seniors. And the reason it gets overlooked is because almost everyone assumes it is just a normal part of getting older. But that is not the most surprising part, because the second warning sign is something that most people would never connect to their heart at all. It is swollen ankles and feet. Now, if you have noticed that your shoes feel tighter at the end of the day, or that your socks leave deep impressions on your skin, or that your ankles look puffy and swollen, especially in the evening, this is a sign that your body may be retaining fluid. And one of the most common reasons for fluid retention in seniors is that the heart is not pumping blood strongly enough to keep it circulating properly. When the heart struggles, blood flow slows down and fluid begins to build up in the lowest parts of your body, which are usually your feet and ankles. Doctors call this peripheral edema, and it is one of the classic early signs of heart failure. Now, I want to be careful here. Not every case of swollen ankles means heart failure. There are other causes, including kidney issues, medication side effects, and simply standing for long periods. But cardiologists say that if you are over 60 and you are noticing consistent, recurring swelling in your lower legs and feet, especially if it is worse at the end of the day and better in the morning after sleeping with your legs elevated. That is a pattern that should not be ignored. It needs to be checked. And the third sign might surprise you even more because it has nothing to do with your chest or your legs. It is waking up in the middle of the night gasping for air. This is something that many seniors experience but rarely mention to their doctors because they assume it is related to allergies, sleeping position, or sleep apnea. And while those can certainly be factors, cardiologists warn that waking up suddenly with a feeling of breathlessness or needing to sit upright to catch your breath can actually be a sign that fluid is accumulating in your lungs while you sleep. This happens when the heart cannot effectively pump blood through the lungs, and fluid begins to back up. Doctors refer to this as paroxysmal nocturnal dyspnea, and it is considered a red flag for heart issues in seniors. If this is happening to you more than occasionally, it is something you should mention to your doctor as soon as possible. Do not dismiss it as just a bad dream or poor sleep. Now, here's where things get really important, because the fourth warning sign is one that sends many seniors to the emergency room, and it often gets misdiagnosed at first. It is dizziness or lightheadedness, especially when standing up. Many people over 60 experience moments where they feel unsteady, like the room is spinning or like they might faint. And while this can be caused by dehydration, low blood pressure, or inner ear problems, it can also be a sign that the heart is not pumping enough blood to the brain. When your heart is weakened or your arteries are narrowed, the blood that supplies oxygen to your brain may not arrive quickly enough, especially during position changes like standing up from a chair or getting out of bed. This can cause sudden dizziness, blurred vision, or even brief blackouts. Cardiologists say this is a symptom that deserves immediate attention, especially in seniors who are also experiencing fatigue or shortness of breath alongside the dizziness. But doctors say the real danger often begins silently with a sign you might feel in your neck or jaw. The fifth warning sign is pain, pressure, or discomfort in your jaw, neck, or upper back. Most people associate heart problems with chest pain, and while chest pain is certainly a major warning sign, cardiologists say that in seniors, especially in women over 60, heart issues frequently show up as discomfort in areas you would never expect. A dull ache in the jaw, a tight feeling across the upper back, a heaviness in the neck that comes and goes. These symptoms are called referred pain, and they happen because the nerves that serve the heart also connect to the jaw, neck, and back. When the heart is under stress, those shared nerve pathways can cause pain to radiate to areas far from the chest. This is one of the most commonly missed signs of heart trouble in seniors because people simply do not make the connection. They visit a dentist for jaw pain, they see a chiropractor for upper back tension. They never think to mention it to a cardiologist, and that delay in recognition can be costly. The sixth warning sign is something that happens to almost everyone occasionally, but becomes concerning when it starts happening frequently. It is an irregular heartbeat. If you have been noticing that your heart occasionally skips a beat, flutters, races, or pounds harder than normal, this could be a sign of an arrhythmia, which is an abnormal heart rhythm. Now, occasional irregular beats are common and usually harmless, but cardiologists warn that when these episodes become more frequent, last longer, or are accompanied by dizziness, chest discomfort, or shortness of breath, they need to be evaluated. Certain arrhythmias, like atrial fibrillation, are particularly common in seniors and can significantly increase the risk of stroke and heart failure if left untreated. The tricky part is that many people get used to the feeling and stop noticing it. They adapt, but adaptation does not mean the problem has gone away. It just means your body has stopped alerting you to it. And that can be dangerous. And now we come to the seventh warning sign, and I saved this one for last because it is the one that catches the most people off guard. It is a persistent cough that will not go away. Most people think of a cough as a respiratory issue, something related to allergies, a cold, or even acid reflux. But cardiologists say that a chronic cough, especially one that produces white or pink-tinged mucus, can actually be a sign that the heart is struggling. When the heart cannot pump blood efficiently, fluid can back up into the lungs. This fluid irritates the airways and causes a persistent cough that does not respond to typical cold or allergy treatments. If you have been dealing with a cough that has lingered for weeks and does not seem to be getting better with standard remedies, it is worth having a conversation with your doctor about whether your heart could be involved. Now, I know that learning about all of these warning signs can feel overwhelming, and you might be wondering what you can do about it. The good news is that there are simple, practical steps that cardiologists recommend for seniors who want to protect their heart and reduce their risk. The first thing doctors recommend is daily movement. You do not need to join a gym or run a marathon. Even 20 to 30 minutes of gentle walking every day can make a significant difference in how well your heart functions. Walking helps strengthen the heart muscle, improves circulation, and helps regulate blood pressure. It is one of the most powerful and accessible tools available to seniors. The second recommendation is watching your sodium intake. Salt causes your body to retain water, which increases the volume of blood your heart has to pump. Over time, this extra workload can wear down the heart. Cardiologists suggest keeping sodium intake below 1,500 milligrams per day for seniors, and being especially careful with processed foods, canned soups, and restaurant meals, which tend to be very high in hidden sodium. The third recommendation is staying hydrated, but not overhydrating. Your heart needs the right balance of fluids to function properly. Too little water makes your blood thicker and harder to pump. Too much can increase fluid volume and strain the heart. Most doctors suggest 6 to 8 glasses of water per day for seniors, adjusted based on activity level and climate. The fourth recommendation is managing stress. Chronic stress floods your body with cortisol and adrenaline, which raise blood pressure and heart rate over time. Cardiologists say that finding simple ways to relax, whether it is deep breathing, listening to music, spending time in nature, or enjoying a hobby, can have a real measurable impact on heart health. And the fifth recommendation, which many doctors consider the most important of all, is knowing your numbers. That means knowing your blood pressure, your cholesterol levels, your resting heart rate, and your blood sugar levels. These numbers tell a story about what is happening inside your cardiovascular system, and they can reveal problems long before symptoms appear. If you have not had a comprehensive heart health check in the past year, cardiologists strongly recommend scheduling one. But here is the single most important piece of advice that heart doctors give to their own patients, and it is simpler than you might expect. Pay attention to changes. Your body knows when something is different. If you notice that you are more tired than usual, more winded than usual, more dizzy than usual, or experiencing new symptoms that were not there before, do not wait. Do not dismiss them. Do not assume it is just aging. Tell your doctor. Have the conversation, because catching a heart problem early is not just about adding years to your life. It is about adding quality to those years. It is about being able to play with your grandchildren, enjoy your mornings, take walks with your spouse, and live fully and independently for as long as possible. Before we wrap up, I want to say something that I think is really important. Growing older does not mean your heart has to fail. It does not mean you are destined for health problems. Your heart is an incredibly resilient organ, and with the right care and attention, it can continue to serve you well for many, many years to come. But it does need your help. It needs you to listen when it sends you signals. It needs you to make the small daily choices that support its health, and it needs you to take those signals seriously, even when they seem minor. So let us quickly recap the 7 warning signs we covered today. First, unexplained fatigue that does not match your activity level. Second, swollen ankles and feet, especially later in the day. Third, waking up at night gasping for air. Fourth, dizziness or lightheadedness when standing. Fifth, pain or discomfort in your jaw, neck, or upper back. Sixth, frequent irregular heartbeat. And seventh, a persistent cough that will not go away. If you are experiencing any of these, please do not ignore them. Talk to your doctor. Get checked. The peace of mind alone is worth it, and the early detection could make all the difference. If you found this video helpful, I would really appreciate it if you would subscribe to this channel. I make videos like this every week, designed specifically for people over 60 who want to stay informed, stay healthy, and stay in control of their well-being. And if you know someone who might benefit from hearing this, a parent, a spouse, a friend, please share this video with them. Sometimes the right information at the right time can change everything. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of yourselves.